Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to Talking Head Pain, the podcast that confronts head pain head on. I'm your host, Joe Coe, and I've been a migraine patient for over 20 years. Have you ever felt that it was hard to get the medication that your doctor prescribed? Have you been frustrated with denials, forced to jump through hoops and take medications that you and your doctor don't think would work for you? That might hopefully change based on the work that the neurologists at the American Headache Society and patient organizations like GHLF are doing. I'm here today with Dr. Ailani and Dr. Tepper, both headache specialists, researchers, and world-renowned neurologists. I'm going to speak with them about how some insurance providers and pharmacy benefit managers might make it easier for you to get access to these newer migraine medications. Really exciting news that we're hearing. Dr. Ailani, I'm going to start with you. Were you surprised when you learned about this change? Can you share who it might impact and what the actual change is and how it came about?
Yes, absolutely. So I will say, let's first talk about what this change actually is. The American Headache Society has updated its consensus statement, basically stating that the society generally believes that CGRP blocking therapies should be first line for preventive treatment. And this is based on what now is a much longer time period of safety and efficacy data, and also some data that really compares our traditional oral therapies that have been around a long time but have not been created specifically for migraine. And there have been some now head-to-head studies comparing anti-CGRP therapy to these traditional agents and showing that these anti-CGRP therapies are better tolerated, patients stay on them longer, and because of that, they tend to do better over time. So there's now enough data that really pushed us to restate that we think these should be first line. And insurance companies and patient organizations really took this up and made some changes. And some of these companies that work with payer groups that are the ones that make decisions on what kind of medications are going to be on your formulary, we call these pharmacy benefit managers, particularly Express Scripts, has made a decision that they're going to allow us to use these anti-CGRP therapies for prevention more as first line without having to go through other steps to receive them. This still means that they require prior authorization, but it takes away this whole idea that we have to try traditional oral generic medications that weren't created for migraine-specific reasons that might carry a lot of side effects. This is pretty big news, and I would say I was really surprised it happened this quickly. I thought, and actually Dr. Tepper and I are well prepared to go in and educate our payer groups, and we're in the process from the American Headache Society to really start to become more involved in order to educate our payers and educate why these medications are important and safe and good for our patients to be able to have access to early on. So I thought we were looking at 1 to 2 years from now before this would happen. We're only several months into this publication. So yes, I'm surprised and I'm really happy as well.
Yeah, and I could just share as a patient that it's really awesome to hear that providers are taking time out of practicing medicine. I guess it's awesome in one way, but sad in another, that you have to fight so hard to get us on the right treatments. But hopefully this will make it easier. And we have to be hopeful. We do know that payers and insurance companies and pharmacy benefit managers play a lot of games with us sometimes. So we're going to stay vigilant, but a win is a win, and we're going to take this and celebrate it. Dr. Tepper, turning to you, what does this advancement of care mean for patients?
Well, let's back this up and talk about how we got to this stage, which I think is a really great first step. And actually, even before the first step, as Dr. Ailani said, the American Headache Society took a position that was based on evidence that patients should not have to go through a series of non-specific, old-fashioned treatments that were laden with side effects and generally didn't work in order to get to treatment that was developed specifically for migraine and which did not carry with it the side effect burden. And the American Headache Society put out a statement filled with evidence in April and encouraged payers and insurance companies to take away these obstacles to care. These were simply obstacles, as you said, Joe, somewhat games that these organizations played in order to prevent people from getting to the care they needed, and for us as practitioners from matching patient need to treatment. what insurance companies generally do in the United States is to use what are called pharmacy benefit managers, or PBMs, that manage what is covered in terms of treatments, what's not, what is necessary for prior approval, and how patients can access these care. And what has happened, and the exciting news, is that one of the big three PBMs in the U.S. announced within this week that they're no longer going to require that people with migraine have to have tried a variety of older medicines and had those medicines fail, and have that all be documented in what are called step edits, but which really are obstacles to appropriate treatment. As Dr. Ailani said, we will probably still have to do prior approvals, but it won't require us doing a long and laborious checklist and people having to go through all of these steps before they can get to appropriate treatment. This is really great news. This is really fantastic. And now we need to turn our attention to those payers that have not yet recognized that times have changed.
100% agree. And I know our organization will stay vigilant on that through our 50-state network of advocates and all of the policy work that we do to make sure that everyone gets the right treatment at the right time in their patient journey. Because we know, and you know better than I do as doctors, that treating migraine earlier reduces the likelihood of disability and chronification of migraine. So we're doing things proactively with these policies to ensure that we live healthier, happier lives as migraine patients. So it just makes sense to us. Unfortunately, what makes sense sometimes doesn't translate into what happens in the real world, and we're really glad that folks are taking the evidence and actually using it to make a positive change. So, Dr. Ailani, how does this change the dialogue between you as a healthcare provider and a patient, or your colleagues and their patients?
I'll say when I first heard the news, the first thing that came to my mind was, oh man, that patient I saw yesterday. I had this very difficult conversation of we have to try 2 generic medications first and then go on what you saw on television and actually came in to see me and wanting to discuss. I don't really have to have that kind of conversation again with certain payers. And that also means that I have to know, and the patient has to know, who their pharmacy benefit manager is. So how are we going to have these discussions with patients where sometimes it's already a struggle understanding this is your insurance and then this is who your maybe 90-day supplier of meds are? That's usually the fastest way I get to who is their pharmacy benefit manager. And then if it's one of the ones that I know might be part of this decision, if I could potentially try offering them a CGRP targeted therapy first line, and is this going to work? Because this is a hope, this is what we're told, but it's still kind of a risk. What if it doesn't go through? What if, we're told July 1st and it's actually middle of July and I give it a try on someone and I'm told, oh no, they still have to try X, Y, or Z because that policy hasn't quite kicked in or they have a certain other type of plan. So it doesn't quite answer that question about the conversation with the patient. What it is telling you is my anxiety as someone who's been doing this for over a decade and has seen the frustration of my patients. I don't want to let them down. At the same time, I want to give them what they want for themselves and what they're going to be able to stay on and has the least side effects and they believe in. Their belief in their treatment, to me, is the most important thing. And so a lot of the conversation has to center about this understanding that there's a possibility you might be able to get this treatment if you have this particular right type of plan. It's a hard conversation to have with a patient. Everyone thinks they have the best insurance. And we're kind of trained to think that, right? I have the best insurance. They always allow me to get everything. And I feel like, oh, I wish every insurance was the best. Actually, most insurance, they're not so great. And it's just about the type of disease you have in the diagnosis and what they want to pay for. And it's kind of heartbreaking when the patient first realizes that, oh, maybe my insurance isn't that great because they're not going to allow me to get this treatment my doctor says is the best. So I have to come up with this way of having this very complex conversation and not let the patient feel let down by something, that their insurance is letting them down, that I'm letting them down, that we're able to cover a backup in case this doesn't work in the first few months. So I think we're really in this process of trying to figure out how to navigate this conversation. I think 6 months from now, it's going to be very simple. Here's all your options. This has the least side effects. This might have some more. What do you think? I can tell you most of our patients are going to choose the less side effect option. Right now, we're in a very testy time period of really hoping this is an accurate situation. having to figure out how we find this, PBM for these certain patients, and how do we educate our patients in understanding if it's not true, this is what a good backup is, and don't lose hope.
Yeah, really, really important stuff there. I know from our position as a nonprofit, talking with legislators and stakeholders around what even a PBM does and what role they have or shouldn't have in our healthcare system is a complicated discussion. I never thought about it as reducing it to your 90-day supplier, but really, what is their purpose? And it's basically to make money. I mean, to boil it down for the insurance company. And that is something that doesn't incentivize necessarily the best treatment. It could. In this case, they're doing the right thing. Congratulations. Let's follow it through and see if it works. And we hope that a podcast like this will help those patients that you might not have more than a couple of minutes to talk to better understand the issue and manage expectations and know that we're not going to give up fighting. Your providers aren't. Organizations like GHLF and the National Headache Foundation and the American Migraine Foundation and the Alliance for Headache Disorders Advocacy and all the groups that do amazing work every day are not going to stop fighting to make sure that you have access. So Dr. Tepper, what would success look like in your mind based on this change in care?
I want patients to be able to get the appropriate medication that their practitioner thinks they need for their migraine. That's success without a lot of restriction, preferably without prior approval. I want to know that when I write a particular treatment for a patient, after the patient and I have discussed it, after we have shared decision making, after the two of us work out a plan that the patient is comfortable with and wants to do, that we can actually execute that and that the person who I'm talking to can go to the pharmacy or put in the mail order and get the treatment that the two of us have decided on. That is success. And I want the entire payer system for the United States to recognize that migraine is serious, that migraine results in significant impact for people, and that it is treatable, and that people's lives can be turned around with appropriate treatment, with minimal side effects, and for the most part. And it's an opportunity to change people's lives, to change the society, to make a huge impact. All we need is payers to recognize that the times have changed and that they need to get with the program and recognize that they have to cover these therapies that are appropriate, that are superior to the old treatments, that have less side effects than the old treatment, that people will take. That's my goal for the future. And I was lecturing about this in Europe recently, in Ireland. And I said, this is not a matter of whether this is going to happen. This is a matter of when this gradually rolls out across the United States and across the world. And this is where we're going to be. People are going to have their lives transformed by migraine-specific therapy.
I love that. And I wanted to circle back to a point that you talked about prior authorizations. It's not lost on me that Cigna is in a lawsuit right now based on using an algorithm and AI to auto-deny 300,000 prior authorizations. We're working against the system that doesn't have our best interest as patients in mind. So we have to be really understanding of that. The people that work at Cigna, fine people, the people that we're going to call, try to get our stuff covered, they're doing their job. They're nice people. I've spoken to them in my insurance company. You can get very frustrated, but they're people. So we're not bashing the people. The companies don't necessarily have our best interest in heart. So it was really exciting when we saw that this change is happening. On one end, rah, this is amazing. On the other, I'm like, well, what are they going to do to make it more complicated? Or what are they going to do? Like we saw it with copay cards and then copay accumulator adjusters and all the ways that companies do things to maximize profit and minimize care. So right now I'm celebrating them. Express Scripts, don't let us down. Get with the program like Dr. Tepper said, and thank you. Dr. Ailani, just to summarize, to wrap up some of the critical talking points or takeaways or top-line things that patients should know about this.
Yeah, so top-line points. Anti-CGRP therapies for prevention of migraine have been recommended as first-line treatment from the American Headache Society. The payers are starting to pay attention, and Express Scripts and Cigna have decided that you no longer will need to go through many hoops, and they're going to put this as first-line treatment without having to go through what's called step therapy. You won't have to try and have failed other oral or other types of preventive medications to have this first. You might still need a prior authorization, and you will have to have the right type of pharmacy benefit and the right type of insurance. So it's really important when you go to see your healthcare provider and say you are interested in first-line therapy of an anti-CGRP medication, that you know what your pharmacy benefit management plan is. It's not what's on that card that you have in your wallet with the insurance logo on it. You can call your insurance company. They can help you figure that out. But walking in with that knowledge is going to be extremely helpful to you and your healthcare provider to making steps to get that medication to you quickly. If you're not sure, there's no way the provider can really figure that out without you knowing. So really coming in with that knowledge is going to save a lot of steps.
Amazing. And Dr. Tepper, 2 questions to wrap this up. What should patients do if their insurance company or pharmacy benefit manager denies their medication? And an additional question that I thought about as I was listening to you both, how should patients educate their doctor if they're not a headache specialist and they might not know about the consensus statement and this change? Like, what should we tell our community if they are not getting covered?
Those are really good questions. Let's start with the practitioner, because if the practitioner is not aware of the position statement from AHS, that's a good place to begin. And a patient can download it. The copyright's lifted, and the senior author was Andrew Charles, and it was published in the journal Headache in April. So everybody can access that through a library. And I would encourage patients to get a hold of that document, and then they can show it to their practitioner. But let's say you have an enlightened practitioner and they have hit the brick wall of a payer. The other 2 PBMs that have not done this are CVS Caremark and Optum, which is part of United Healthcare. So United and CVS Caremark have not removed the step edits for most patients, while Cigna and Express Scripts have. So if your PBM is CVS Caremark, and almost certainly if it's Optum United, they will require the step edits. You may, as a patient, have to go through those step edits in order to get to appropriate treatment. But I think I would write to the PBM and to your payer and point out that Cigna and Express Scripts has lifted these obstacles to treatment, that the American Headache Society has recommended that they not be done anymore. And then the last piece of this is if you have an HR person at your employment, I would let the HR person know that your particular PBM is restricting treatment that the National American Headache Society has said they should not be doing.
100% agree. I would be really upset if I didn't say this, and I use this term payer. It's not necessarily the best term, and I wanted to flag it. The employer, and you brought up talk to your employer, the employer is the payer. We pay the insurance companies to provide a service, and we use this language like they're doing us a favor. They're providing a service that either we pay for, the government pays for, or our employer pays for. So we're actually the payers, but it's shorthand. I use it, but I would be remiss if I didn't give my little dig around that language. Really appreciate the discussion. Is there anything that we didn't cover that you feel we really need to highlight?
I think I just want to echo what Stu was saying and just remind all of our patient listeners that you do have the strongest voice. My patients often think that we as the physician do. No, not anymore. You are the payer for the insurer. And if the insurance company isn't allowing you the treatment that you believe is the best for you, you have every right and everything behind you to appeal their decision. And now we have authored and really stood behind a very strong article that you can actually Google search and download for free. The American Headache Society most recent position paper published in 2024. There are 3 of these. That's why we keep mentioning look for the one for 2024. That's the one that will tell you that we think that first line should be these anti-CGRP treatments. And when you write an appeal and you include the reference to that article, it's going to be very hard for them to give you an answer that opposes what a national organization is standing behind. But your doctor doesn't have the power that you do. So just remember that.
I would just like to close on a note of hope. This is such a fantastic time for patients to have these therapies that are marvelous, that are life-altering, and that have minimal to no side effects for most people is the greatest experience as a practitioner and a partner in healthcare with my patients. I cannot tell you how excited I am and how I look forward to helping people and encouraging all of the system to make these therapies available for people when appropriate. It's going to be a fantastic ride, and I really look forward to the next several years.
Thank you for listening to this special episode of Talking Head Pain, the podcast that confronts head pain head on. If you have any questions or thoughts or suggestions for us, we would love to hear them. You can send us an email at podcast@ghlf.org. If you enjoyed this episode, please give it an honest 5-star rating, write a positive review, and spread the word by sharing it with your friends and family. I'm Joe Coe, and I'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.